Hello, and thanks for joining us today. I am here with Lakeland Regional Health to talk about the brand new Pediatric Intensive Care Unit. This new Pediatric ICU is a collaboration between Lakeland Regional Health and the Nemours Children's Health System. So with that, we'll do introductions.
Hi, I'm Dr. Al Torres. I'm a pediatric intensivist. I serve as the medical director for the pediatric programs at the Partnerships for Nemours, and I'm also the medical director of the new pediatric ICU at Lakeland Regional Health.
Hi, good afternoon. I'm Lori Shea. I'm the Associate Vice President of Women's and Children's at the Pavilion here at Lakeland Regional. We're excited to share with you today that beginning September 1st, we'll be opening our Pediatric Intensive Care Unit.
Hi, I'm Joy Boyd. I am the manager for pediatrics in our Pediatric ICU at Lakeland Regional.
Thank you all so much for joining me today. So we'll start just by talking about what exactly it means to have a pediatric ICU here in Lakeland and how that is different from the existing care in pediatrics at the Women and Children's Pavilion, excuse me.
Because of the collaboration between Nemours and Lakeland, we care for a large number of kids in Lakeland that ordinarily would be sent to a children's hospital in Orlando or Tampa. We have specialists that see kids in the outpatient and inpatient world at Lakeland. But what we're doing starting September 1st is having pediatric intensivists. These are pediatricians that are specifically trained to care for sicker children that require a higher level of care. For example, being on a ventilator if their lungs require that, receiving blood pressure medicine if their heart's not squeezing well. So those kinds of therapies often require special training, and we're going to be staffing the pediatric ICU with intensivists like myself 24/7, 365 days a year starting September 1st. So we're excited to be doing this at Lakeland Regional with the folks that are there.
We have a 2-member child life specialist team, and their role is to work with the kids that are admitted through the ED and onto the floor and in the PICU, and help make what can be a traumatic experience less traumatic for them, helps them process it at their level. So that is integral as we grow our program to have that team. And then our nursing team, the nurses that we have are all pediatric trained nurses. But over the last year, we have intensified their training, and they have trained at Nemours, here in our ICUs, have had classes with our clinical nurse specialist, and had simulations with Dr. Torres and other intensivists in preparation to step up to this higher level of care that we will be providing.
We also have ensured that Lakeland Regional has all the ancillary support to support this program, such as our respiratory therapy program, as well as our nutrition program, and as well as it's important as families are here and we're caring for them and have really spent a lot of time and diligence being ready for that. Also preparing our staff to be able to get the families back home. And so we have a team that will help with some of that discharge planning as well. So just excited to say that over the past year, we've done a lot of planning, a lot of drills to be ready for this, to support the families of Polk County so that, as Dr. Torres alluded to, they don't have to travel to Orlando and Tampa, but they can remain right here in their home community to receive that care.
That is exciting. I know it means a lot for families. They may not even realize yet what it means for our community until you need those higher levels of care for your children. So if there is someone who currently has a child who they know who's medically complex, and when they have a need, they maybe load up the car and they drive to Tampa or they drive to Orlando, wherever they're used to going, and they want to figure out if instead their needs can now be met in Lakeland. How can they figure out if you can meet their needs, I guess is the best way to put it?
I think they should talk about it with their primary care physician.
Okay.
Their primary care physician will have information on the services, or at least can acquire information on what services are being provided at Lakeland and whether those will meet their needs.
Is the PICU set up to where parents can stay overnight with their children?
Yes. That is still, even during COVID, mom and dad or mom and mom can still stay in the room with their child. I know for the ICU setting, sometimes it can be a little different having other people in the room, but for now we do have both parents.
In addition to that, the uniqueness of the pavilion and how it was built is our patients have individual rooms, so they aren't sharing rooms with others. So that really allows our families to participate in their care and be right there at bedside with our patients.
Can you talk briefly, I know that nurses play a huge role in this too, of being part of the continual care team. There's only so many doctors and so many specialists that make rounds and are, seen certainly often enough, but it's really the nurses who are providing that hourly care.
Sure. So these nurses that have had this additional training in an ICU setting, the ratio of nurses to patients is drastically reduced so that they can provide that bedside moment-to-moment care throughout the day. So in our PICU, for a very critically ill child, the nurse would be one-to-one with that patient. For children that are getting better, maybe a 1-to-2. But that nursing care is at the bedside for that 12-hour period. There's somebody always monitoring that patient, adjusting settings and drips and in constant communication with the physician. And the rest of the team, which includes our respiratory therapist, our pharmacist, social worker. So it's a multidisciplinary team that the nurse is working with to provide that care.
Any other information that you think is especially relevant to families as far as the new PICU? Both families that, like I said, may have to have frequent visits to the hospital, or a family who doesn't and doesn't even realize they'll have a need for the PICU until something happens.
Yeah, that's a good point, April. And I think just to emphasize the fact of we have a very robust emergency department here at Lakeland Regional, specifically separated from our main ED, so our pediatric or our peds ED is one that we would encourage you to bring your children to. And if the child needs that higher level of care in a pediatric emergency or ICU, we will have those capabilities. And that's really where we will see admissions come from, is from our either pediatric ICU, or pardon me, our pediatric ED, or the patients have been seen in the physician's office, and the primary pediatrician has sent them to our ED to be further assessed. And in addition to our partnership with Nemours, our intensivists will be working very closely with our ED physicians to help support the services down in the ED so that we can keep children here locally in the Lakeland area.
Well, I appreciate all of you joining me, and I am so excited for our community, for the services that you will be able to provide to families and to children. What an amazing difference for a family to be able to stay right here in Lakeland when their children need emergency care. And we appreciate the work you've done to make that a reality. So September 1st, the new Pediatric Intensive Care Unit opens at Lakeland Regional Health. We certainly hope you don't need to use it, but if you do, it is there to serve you, and they are prepared and ready.